This is Julie with Palmer Acupuncture. I'm going to show you cupping this morning. So basically, patient goes face down. If patient isn't comfortable being face down, we can always do this in a seated position as well. This is just sunflower oil I'm going to apply to his back. So the purpose of cupping is to loosen up the muscles and tissue, where especially for people that work out a lot, they get nice and tight. So for people that your shoulders feel tight all the time, this is an amazing therapy that goes much deeper than a deep tissue massage. So basically we are going to light fire, put it in the cup to burn away the oxygen. It achieves suction, and then there are different types of cupping. I mainly do sliding cupping instead of stationary cupping because it helps break up stagnation better and it loosens the muscle tissue easier. So you're just sliding back and forth. For me as a practitioner, when I'm sliding, I can feel it pulling tighter where you have tight muscles, but for you as the patient, you'll also feel it pulling harder and it'll hurt a little bit more where you have areas of tightness. So basically I go with the muscle fiber and then I go against the muscle fiber. So this may cause bruising for up to a week. Usually for most people it's a few days. If you don't get bruising, it's still working, don't worry. And you may feel a little sore for a couple days. That's completely normal. Usually for most people it'll take a few sessions to get the lasting effects from cupping. How you doing? Doing okay? Okay. So you check in with the patient, make sure they're hanging with you. Usually you can feel them moving around or they'll tell you something if it hurts too much, and then you always have to pay attention to your patient's needs. So if it hurts too much, go ahead and stop. So basically this is cupping. You can use different size cups depending on whose back you're on, or if they can't tolerate the sliding cupping, then you can always do stationary cupping. So if somebody has frozen shoulder, I would concentrate more up on the shoulder area. Somebody has tight traps, I concentrate on the traps. For someone that has mid-back pain, you can also do it for there. It does work for low back pain, but usually it's more painful on the low back, so I don't personally usually use it on the low back. I release the muscles with needles, okay? That's it for this episode of cupping.